Telehealth is the use of digital technologies to access healthcare services remotely. For those living in remote areas like Nunavut, telehealth is a lifeline. Without telehealth, residents would have to travel long distances for basic medical consultations. Telehealth bridges this gap by providing immediate access to healthcare professionals. It allows for continuous monitoring and follow-up, crucial for chronic conditions. A nurse practitioner in a city can extend their expertise to patients hundreds of miles away. Nurse practitioners are at the forefront of telehealth services, acting as the bridge between patients and doctors. They use video calls to assess patient conditions, provide consultations, and offer medical advice.
A common scenario involves a nurse practitioner conducting a follow-up video call with a patient who recently had surgery. The nurse practitioner can visually inspect the healing process, ask about pain levels, and provide instructions for wound care.
Phone consultations are another key tool.
By leveraging these technologies, nurse practitioners ensure that patients receive timely and effective care.
Section 4. Protocols ensuring client safety. Client safety is paramount in telehealth.
One key protocol is verifying the patient's identity at the beginning of each call to avoid any mix-up of medical records.
Another protocol involves the use of secure and encrypted communication platforms.
Nurse practitioners are trained to use these platforms efficiently, ensuring that patient confidentiality is always maintained.
Nurse practitioners also conduct thorough assessments during telehealth sessions to ensure they do not miss any critical signs or symptoms.
In case of any uncertainty, nurse practitioners are trained to escalate the issue to a physician or recommend an immediate in-person visit.
Section 5. Facilitating in-person care when telehealth isn't enough. While telehealth is incredibly useful, there are situations where in-person care becomes necessary.
They assess the severity of the condition and determine whether a telehealth session is sufficient or if an in-person consultation is needed.
They coordinate with local healthcare providers to ensure a seamless transition from telehealth to in-person care.
Additionally, nurse practitioners assist in making transportation arrangements for patients who need to travel for medical care.
Nurse practitioners also follow up after the in-person visit to ensure that patients are adhering to the treatment plan and recovering well. Section 6. Dealing with technology failures and backup plans. Technology is not infallible and telehealth services can face technical challenges.
One common issue is connectivity problems. Nurse practitioners are trained to troubleshoot minor technical glitches and guide patients in resolving issues from their end. In cases where a video call drops, nurse practitioners switch to phone consultations to continue providing care.
They remain calm and reassure patients, emphasizing that their health and safety are the top priority.
Nurse practitioners also have protocols for documenting any technical failures and the steps taken to address them.
In instances where technology completely fails, nurse practitioners have a list of emergency contacts and nearby healthcare facilities ready. Section 7. Conclusion. Bridging the healthcare gap in remote communities. Telehealth nursing has revolutionized healthcare in northern communities. By leveraging technology, nurse practitioners provide timely and effective care, overcoming the barriers of distance and harsh weather. Strict protocols ensure client safety, and nurse practitioners are adept at facilitating in-person care when needed. Telehealth is not just a temporary solution, but a sustainable model that bridges the healthcare gap in remote areas.